So if you've had a gastric band inserted, about 4 weeks after you've had the operation, you'll be called back in to see the surgeon to have some fluid inserted into the band. When the band is first inserted, the surgeons don't put any fluid in it. The reason for that is because it sits quite snugly around the top of your stomach and it causes some localised swelling. So if we then went and put fluid in on top of that, you wouldn't be able to drink anything or eat anything at all. You may find that about 3 weeks after the insertion of the band, you're starting to feel hungry like you did before. That's absolutely fine. It's absolutely normal. It tells us that the localised swelling is reduced and there's a little bit of room around this band. Now what will happen is you'll need to have a band adjustment done about every 4 weeks. In your first appointment, it'll be when the sort of base load of fluid is put into your band. And this is sometimes 4 mils, sometimes 3 mils, sometimes 5 mils, it depends. But what will happen is the surgeon will locate the port that has been inserted just into your abdominal wall there, and they will then insert a needle into the port and put some fluid in there. They will then ask you to sit up, probably with the needle still in your port. So if you're a little bit squeamish, probably best not to look down. They will then give you a glass of water and ask you to drink the water and ask you how it feels. And what they're looking for is to make sure that the water is going down in a slow, controlled manner, that it's not getting stuck in your throat, that you're not coughing it back up, but that you're not able to drink gallons and gallons of water without any restriction whatsoever. Now, what I would say to you is after you've had this done and the surgeon and yourself have decided that the amount of fluid that's in there is okay, stick to fluids for the next 24 to 48 hours because, again, you will get this localised swelling around the band because we've just filled it up and it's sat tightly around the top of your stomach. If on the first night you find that you cannot swallow anything, that you are coughing, you've got heartburn and reflux, get in touch with your nurse specialist or with the hospital because you may need some fluid taken out of the band. It isn't an exact science, unfortunately, and everybody is different. What I would say to you is, if after the first couple of days on fluid, you find that you can eat quite a lot and that you're feeling very hungry, again, get in touch with the nurse specialist. It may just be that we need to tweak it a little bit. Now, one point that I will make that a lot of patients tend to do is to compare themselves with each other and say that she's got 5 mils in hers, I should have 5 mils, she's got 7, I need 7. Everybody is different and the size of band is different depending on the size of your stomach. And just because you're overweight, it doesn't mean that you've got a massive stomach. It depends on the size of your stomach when the surgeon gets in there. So please don't compare yourself to other people that have had this surgery done. With a band, what we want is for you not to be searching for food in between meals, to be satisfied on 3 small tea plates of food. We don't want you to be so restricted that you can't swallow anything because that will actually form bad eating habits. You will eat things that will slip and slide down there, such as milkshakes, ice cream, and things that are loaded with calories and fat. We want you to be able to eat normal food, but only a small amount of it. So please bear that in mind.